thanks for watching this video. The reason you're watching this is you probably have some questions or some interest in implants, and specifically snap-in implants, okay? So what a snap-in implant is it is a bridge that you can take in, take out to clean, and it works really well if you're missing teeth, if you're missing some of your teeth, if you have really bad gum disease and we can't save your teeth. This can be a great option. All right, so a couple cool things about snap-in implants is we do warranty them, okay? We warranty them for years depending which one you pick. We have a couple different options. As long as you're coming in every 3, 4, 6 months for your checkups in our office. So we want to make sure when you get this new smile, it lasts for years to come. There are some things on there that need a little bit of maintenance. It's like a high-performance vehicle. You know, you got to replace the tires and change the oil once in a while. These are much the same. Your implants, they're not a one and done. There is ongoing lifetime maintenance. So you got to keep that in mind. All right. But snap-in implants, we include a warranty on those, which is pretty cool. Okay. The other thing that's really great about snap-in implants is they're very affordable. All right. So if you were to go through your mouth and have an implant replaced where every tooth was, you could be in the multiple 10s, 20s, you know, even $80,000 potentially. Okay, with snap-in implants, it's much, much less because we're doing multiple teeth together. That passes the cost savings on to you. So for people who want to get into implants, but not necessarily do the platinum highest level option, the snap-in implants are fantastic because you can get a smile that you're really confident with, and you can do it affordably. Okay. The other great thing is that you will be able to smile much more. Okay. So with snap-in implants, you can eat foods you enjoy. You'll be confident with your friends. You and I will be the only ones who know these aren't real teeth, and we're not going to tell anybody. So that part's up to you. All right. But with the snap-in implants, they'll look just like real teeth. We can make them as bright as you want, as natural as you want. You can make them big, small, something in between. We have all kinds of shapes and sizes. After doing many, many of these for many happy patients, ultimately we want you to be able to smile and be happy with your decision. So who are these not for? Okay, snap-in implants are not for someone if you want something that does not come out. Okay, so if you are adamant that your teeth do not come out to clean, then these are not for you. Now, that doesn't mean they'll come out when you're chewing or eating. That's not what I mean. What these snap-in implants, you do have to take them out a couple times a day between meals. Take a brush and clean underneath them, and then clean around the implants in your mouth. So I have an example right here. Okay, this is a snap-in implant. As you can see, this full bridge right here, would something like this would be in your mouth, and it would clip into these implants. Okay, so as you put it in and it snaps in, okay, you can chew, eat, speak, laugh, anything you like to do, you will use these implants just like you would teeth. All right, but after lunch or after dinner, you're going to want to pop it back out. Okay, you're going to want to go underneath it with a soft toothbrush and clean, and then you also want to clean these shiny implant balls here to make sure they stay very clean. All right. When someone's having a problem with implants, we can usually tell because if we look at these, they'll be dirty or have plaque on them or food. We know people aren't brushing around them well enough. That can cause you to lose the implant. Okay. So snap-in implants, really cool option. Okay. For some people, we like these better than the permanent because the ease of cleaning. Okay. So with permanent implants, usually you'll have to come in and have us professionally clean them a few times a year. You should still do that with the snap-in implants because we do need to service some of the parts. But on a day-to-day basis, you can clean these much easier. You know, think about how much work goes into flossing your teeth. This is great because you can basically take it out and floss them all at once and then just clean out your implants. Okay. If you are concerned about having a temporary denture for a while, okay, this is not for you. Okay, what I mean is, with most of these snap-in cases, you will have some transitional teeth. You have teeth the whole time during this process. Okay, it takes usually between 4 and 7 months before you start till you get to your final destination of your new smile, okay? Usually takes 4 to 7 months along the journey, okay? But during this whole time, you have teeth. But for about, 2/3 of it, okay, you'll have some transitional teeth, okay? And they, depending on your case, they may or may not be connected to those implants yet. And so you will have teeth that are a little bit more like a denture, okay, that you actually will take out. They don't chew really well, but they look just like real teeth. They look nice. You can speak with them, okay? By the time you're done, you'll be able to chew, eat, speak, whatever you like to do, okay? So to kind of give you some contrast, okay, if a full set of your own natural teeth or a full set of individual implants, we'll say that's 95 to 100%, okay, of function, okay? Meaning if I have all my own teeth or a full mouth of individual implants, I can chew 95 to 100% as well as the best case scenario. With a denture alone, okay, someone's usually at about 10%, okay? So if you just have dentures, no implants, you can chew about 10%. Now people ask us all the time, they say, well, half my teeth are gone, or I'm not happy with my teeth, or they hurt. This has got to be better than nothing. And the answer is yes, it's better than nothing, but it's not better than the teeth you have now, okay? So when you get a snap-in bridge, okay, usually you end up somewhere around here, okay, in the 60 to 85% range, okay? So to get all the way up here, okay, this is going to be your most expensive option, which is not a snap-in implant. But to be in the 60 to 85% of chewing ability, meaning you can eat corn on the cob, you can eat steak if you want, salad, crunchy vegetables, you can do all that with a snap-in implant, okay? You can't do it very well with a regular denture, but you can do it well with these, okay? And within this range, we have a couple options for you on the snap-in dentures that we can go over with you. And those work really great. So if you want to smile again, okay, if you want to be out of pain, if you want to get rid of disease that's in your mouth, okay, and if you want a wider smile, all right, then the snap-in implants are a great option for you. We have a whole list of things on how to clean it, what to do before, what to expect. We give you a whole timeline. Okay, but to kind of walk you through the journey that most people have with snap-in implants is we will make some new teeth for you ahead of time, and then in one visit you'll come in and we'll take out all the bad, broken, diseased teeth and we'll give you this healing set of teeth, okay? And then we'll wait about 3.5 to 4 months, and then comes phase 2 where we put new roots in, okay? And those are what are the actual implant, but we put these new roots in where your roots were, and then you will continue to wear those healing dentures for another 2 to 3 to 4 months, okay, in that range. And then at the end of that, those implants, they've fused to you, they're now part of you, and we can now connect a new bridge to those implants. That's not a denture, it's not going to cover the roof of your mouth, okay? This is your final bridge. It will clip into those implants and clip out, and you will love it. It's not going to move or pop out when you're talking or eating, all right? As far as cleaning goes, okay, you'll use a soft toothbrush, and you can use something like clear dish soap, okay? I wouldn't use anything really abrasive, like toothpaste, or something with a lot of abrasives in it, powders, because you can take some of the shiny finish off, all right? Use a soft toothbrush, and you can clean the food and plaque that gets stuck on there, and that works really well. You can soak it in a cleanser with like a baking soda tablet. You just don't want to rub that into the teeth. That helps keep it white and fresh. And you don't want to put it in any alcohol-containing rinses, so no Listerine, no mouthwashes that have a lot of alcohols in them. You can use a little bit of something with some mint in it, which a lot of people like to do, and that works out great. So that's in a nutshell how the snap-in implants work. Okay, our patients love these. We do these all the time. Most of our patients who are missing some or all of their teeth go with this option when we're doing a full mouth replacement. Very popular choice. So let us know what additional questions you have. You don't have to remember everything in this video. We will walk you through it along the way, because it took us years to master this in dentistry, so we don't expect you to know it in just a couple of visits, all right? But we'll give you some handouts, You may get some mouth rinses and different prescriptions along the way. We'll help you there. And if you'd like sedation for this, we offer some great sedation treatments to make this as comfortable for you as possible. So if you can have some patience and you're willing to go through this journey with us, then we may be able to help you out, and snapping implants may be just the thing for you. So thanks for watching today.